We'll talk about beginning some form of treatment, whether it's medication or bedwetting alarms, when the bedwetting is bothersome, not just to the parents, but to the child. And the child is really willing and ready to do something about it, because they really need to be engaged in whatever treatment you choose. Medications can be effective temporarily for bedwetting. So they're a good option if kids are going to summer camp or they have a sleepover they want to go to and they don't want to take a pull-up along or something like that. Because what they do is they'll temporarily decrease the amount of urine and decrease the bedwetting that the child has. But when the child goes off the medications, most children tend to go back to just about as much bedwetting as they were doing before. The other option that families have is an alarm system. And most kids, by the time they're 7 or 8, are developmentally ready to engage with a bedwetting alarm, which is basically a device that is attached to the front of the underwear. When it detects wetness, it sets off an alarm and it wakes the child. The key for a bedwetting alarm to work is the child has to be engaged in this. So they need to be the one who gets up and turns off the alarm, who changes the bedclothes, uses the bathroom and resets the alarm. So this really has to be them retraining themselves. Parents do need to be engaged in this, because at first no 7 or 8-year-old is going to want to get out of bed and turn off the alarm and change all the bedding. These kids tend to be deep sleepers, and so the alarm will tend to wake up the whole family before it wakes up the bedwetting child first. About 70% of people who use them and use them consistently over several months will find that the bedwetting is gone. So this is the one that really will retrain the body and help to cure the bedwetting. Reassuring your child that the things you do in your sleep are not things that you choose to do. These are things that your body does without you controlling it, and so it's not your fault if you're wetting the bed at night. And also reassuring kids that this is a fairly common thing, that lots of kids they know probably wet the bed at night too, and just nobody wants to talk about it.